After surgery, your surgeon will give you instructions on how to care for your wound and how to prevent infections. One of the important ways to prevent infection is to wash your hands before and after wound care. If you notice any pain, swelling, warmth around the site, or fluid oozing out of your wound, please visit a healthcare provider as you may have an infection.
Ever wondered how wounds are cared for after a cosmetic surgery? Well, you're about to find out. Today, we're discussing nurse treatments for wound care post-cosmetic surgery, a topic that is more relevant than ever in this year, 2024. Cosmetic surgery, a tool used by many to enhance their appearance, does come with its fair share of aftercare. This mainly involves wound care, a crucial step in ensuring a successful recovery and preventing infections. Nurses play a pivotal role in this process. The first thing to understand is the types of wounds one might have after cosmetic surgery. These could range from incisions, which are essentially cuts, to bruises, the colorful marks you often see. Keeping these areas clean is paramount in ensuring a smooth healing process and warding off infections. The process of wound healing is a natural one and occurs in stages. It kicks off with hemostasis, the formation of blood clots to stop bleeding. This is followed by inflammation, signified by redness and swelling, indicating your body's defense mechanism at work. The third stage is proliferation, where new tissues form to seal the wound. The final stage, maturation, is when the wound heals completely. Remember, healing is a process that requires patience. Now, how do nurses treat these wounds? Their first step is to clean the wound. This involves washing their hands thoroughly to ensure a germ-free environment. They then use a disinfectant or sterile saline water to clean the wound, drying the area with a clean cloth or sterile gauze pad thereafter. The next step is applying dressings and bandages. These serve to keep the wound clean and protected. A sterile gauze pad or dressing is placed directly on the wound, secured with adhesive tape. It's crucial to follow your doctor's instructions when changing these dressings. It's also important to be aware of the signs of infection. These include increased redness, swelling, warmth, pus, or a fever. If you notice any of these signs, it's imperative to get in touch with your doctor immediately. Nurses, being trained to spot infections, will also be able to assist. Preventing infection is key. This can be achieved by regular hand washing and avoiding touching the wound unless necessary. The key is to keep everything clean and as germ-free as possible.